Good morning, everyone. Thank you for joining us. Welcome back. We're going to try and get you through your Monday morning. I'm Steve.
And I'm Scott.
Together, we're Backyard Musing, Science and Technology channel.
Yep. And Steve pulled a little April Fool's joke on me yesterday, and it's all good. Anyway, we're talking about a good story today. We like these stories. We're really happy when we hear about things that are going to improve or help to improve Alzheimer's and dementia, and this is one of them. So this is a good one.
So it's cool. A new, stronger flu shot could slash Alzheimer risk in half, according to new data. The study, led by researchers at the University of Texas Health Science Center at Houston, so UTHealth, found that adults 65 and older who received a high-dose influenza vaccine had a significantly lower risk of developing Alzheimer's disease compared to those who received the standard dose. Would you like to know more?
Okay, before we go on, I just want to clarify from my own mind, because I'm a simple guy. University of Texas is kind of like University of California, right? There are many campuses?
Many, yeah.
Okay, gotcha.
UT El Paso, UT Austin, UT Arlington, yeah.
Okay. But who's the Hook'em Horns? Is that Austin?
Horns is like Tennessee, right? Or Texas?
No, University of Texas, I thought. Hook'em Horns, right?
I don't know. Yeah,
Okay.
I don't know.
All right. Let's see. The immune system naturally weakens with age, making older adults less responsive to standard vaccines. To combat this, the Centers for Disease Control and Prevention recommends a high-dose flu vaccine for people over 65. So I have never, and I'm over 65 by quite a bit, and I have never had a flu vaccine. But I wonder if I maybe should change my mind because of the story. This version is approximately 4 times stronger than the standard shot. Alzheimer's disease, a brain disorder that slowly destroys memory and thinking skills, affects more than 6 million Americans, most of them age 65 or older. That's a pretty high number.
I think it would be worth asking your doctor, can I get a higher dosage since I'm over 65?
Yeah, well, I'd have to get one of those first. So, but yeah. Anyway.
Okay. As the vaccine directly affects the immune system, it is possible that this interaction could decrease inflammation in the body and thereby indirectly decrease Alzheimer's risk. Flu shots and their components do not cross the blood-brain barrier, meaning they aren't directly affecting brain cells, said Dr. Mark Siegel.
That's not the Mark Siegel that's on Fox, is it?
Yeah, this story is from Fox Digital.
Same guy? Okay.
Yeah.
Quote, I was stunned that as a physician, I didn't know a higher dose was offered. That was from lead study author Paul Schultz, professor of neurology at the McGovern Medical School at UTHealth. And he said that in a press release. Schultz also led a previous study linking general flu vaccination to a 40% reduction in Alzheimer's risk. While the previous research had already linked general flu vaccination to a reduction in Alzheimer's risk, this new study looked specifically at the strength of the dose.
Okay, so I guess the flu vaccine in general is good to fight Alzheimer's.
Okay.
Quote, the public health department had seen our vaccine research and asked if I could come down to talk to them about it, said Schultz. Continuing his quote, we went through the findings and they asked if there was a difference with different dosages. I was confused. After sorting through data from nearly 200,000 older adults, the team found the adults who received the high-dose vaccine had a lower risk of Alzheimer's than those who received the standard dose.
Okay, so again, I didn't realize that there was a high dose or standard dose.
Well, you're hearing it here.
Yeah, I get that, but I mean, and I wonder what qualifies you for the high dose versus the standard dose.
I guess you just ask for it.
Age, maybe
older people. Yeah, age.
Yeah. All right. Adults in the high dose group had almost 55% lower risk than those who weren't vaccinated, significantly outperforming standard dose protection. The protective effect of the high dose vaccine was even more pronounced in women compared to men, although both groups saw significant benefits. I wonder why that is. That's interesting.
This study shows a link, not a cause, the researchers noted. As experts can say for certain that the flu shot itself, they cannot say for certain that the flu shot itself stopped Alzheimer's, because people who get high dose vaccine might also have other healthy habits like better diets or more frequent checkups.
The researchers also looked at medical records after the fact, rather than following two control groups in real time, which can sometimes result in missing information or biases. Quote, "This is not a cause/effect study," Siegel reiterated. Going on with the quote, "We can't conclude that the flu shot itself causes the effect. It could be something about the people who decide to take this flu shot." Interesting.
The study also focused on people over 65, so it's unclear whether getting these shots earlier in life would provide the same level of protection. Quote, "This needs to be further studied, aka give me your money, but it is already certainly another reason to take a flu shot," Siegel said.
All right. Again, I'm not sold on the flu shots. I remember watching my parents and other people that I knew that would take these flu shots when they were in their older years, and they would get sicker than a dog. And of course, it would pass. But I thought, man, it's one of those side effect deals. So I don't know. We'll see.
All right, folks. Thanks for joining us.
Take care. We'll see you this afternoon.